Om Shri Narayana Gautama Guru
Very good evening to all of you. Today we are going to do the MCQ challenge of obstetrics and gynecology. Remember, obstetrics and gynecology is a very important subject as far as NEET PG is concerned. So let's begin with the first. About 25 questions in NEET PG are expected from obstetrics and gynecology. Regularly it comes. So the more you prepare this subject properly, most of the questions are clinical questions and some of the factual questions can also be asked. And most of the questions are easy. If you practice them again and again, you will be able to solve them, all of them. So let's begin with the first question. Zygote with zona pellucida reaches uterine cavity by. Zygote with zona pellucida reaches uterine cavity by A 2 days, B 4 days, C 5 days, D 6 days. What do you think is the correct answer? It is 4 days. The role of human placental lactogen is it is the growth of fetus. The most common site of implantation of tubal pregnancy is A. Interstitial portion of fallopian tube, B. Isthmus, C. Ampulla, D. Infundibulum. It is ampulla. 2-day NEET PG Breakthrough Blueprint Masterclass. Click the link in the description box to join the 2-day NEET PG Breakthrough Blueprint Masterclass. During which gestational age is peak serum HCG levels attained? A. 7 to 9 weeks, B. 11 to 13 weeks, C. 20 weeks, D. 25 weeks. It is 7 to 9 weeks. What would be type of presentation when engaging diameter is meant to vertical? A. Face, B. Brow, C. Vertex, D. Bridge. It is brow. Brow presentation. Brow presentation, the engaging diameter is meant to vertical. Brow is the rarest variety of cephalic presentation where the presenting part is brow and the attitude of the head is sharp so that the degree of extension necessary to produce face presentation. In face presentation, the presenting part is face. The attitude of fetus shows complete flexion of the limb with extension of the spine. The commonest position is left mento anterior. The engaging diameter of the head is submentopragmatic, 9.5 cm in fully extended head or submentovertical, 7.5 cm in partially extended head. It is broad. Most common cause of secondary PPH is A. Uterine inertia, B. Retained placenta, C. Episiotomy, D. cervical tear. It is retained placenta. Bleeding usually occurs between 8 to 14 days of delivery. Causes of late PPH: retained bits of cotyledon or membranes. It is retained placenta. Incidence of scar rupture in a subsequent pregnancy in case of lower segment cesarean section is A 2 to 2%, B 4%, C 5%, D 8%. It is 2%. Subpubic angle, it is 85, less than 65, 65 to 75, C 85 degree, 110 to 120 degree. It is 85 degree. Rule of Hasse is used to determine the age of fetus, height of an adult, race of a person, identification. It is the age of fetus. Calculating the age of fetus. Indication of acyclovir in pregnancy is A. Disseminated herpes, B. Chickenpox in first trimester, prophylaxis in recurrent herpes, D. All of the above. It is in fact all of the above. So correct answer here is D. All of the above. Human placenta is A. Discoid, B. Hemochorial, C. Deciduate, D. All of the above. C. The human placenta is discoid because of its shape, hemochorial because of direct contact of chorion with maternal blood, and deciduate because maternal tissue is shed at parturition. So all of them. Heart flashes are experienced as a result of A. Increased noradrenaline, decreased estrogen, increased noradrenaline, decreased estrogen, increased noradrenaline, estrogen. It is increased noradrenaline, decreased estrogen. Cephalic index is A. BPD upon OFD, BPD upon HC, COFD and BPD HCl. It is BPD upon OFD. In MRKH syndrome, which among the following is absent? A. Vagina, B. Breast development, C. Pubic hair development, D. Testis. It is testis. MRKH syndrome is also known as MURCS syndrome, Mullerian agenesis, renal aplasia, cervicothoracic somatic dysplasia. MRKH, Mayer-Rokitansky Castellano syndrome, has a karyotype of 46XX. So the gonads present are ovary in contrast to androgen insensitivity syndrome where the testes are present. MRKH syndrome is characterized by congenital aplasia of the uterus and upper part of the vagina in women showing normal development of secondary sexual characteristic and a normal 46XX karyotype. In polyspermy is inhibited by which ion? A Ca plus Ca B Na Ck B Cl. It is Ca. Maximum amniotic fluid is at A 32 weeks, B 34 weeks, C 36 weeks, D 40 weeks. It is 36 weeks. Fertilization usually occurs in which part of fallopian tube? A fimbrial and B ampulla, C interstitium, D isthmus. It is ampulla. Physiologic change in leukocyte number in pregnancy is A neutrophilic leukocytosis, lymphocytic leukocytosis, neutropenia, basophilic leukocytosis. Neutrophilic leukocytosis. Weight of uterus at term is A 400 to 500 gram, B 600 to 700 gram, C 800 to 900 gram, D 900 to 1000 gram. It is 900 to 1000 gram. The uterus in non-pregnant state weight is about 60 gram with a cavity of 70 mm, measures 7.5 centimeter length. Please click the link in the description box to join the 2-day NEET PG Triple Paid Masterclass. Urinary retention earliest in pregnancy is A 10 weeks, B 18 weeks, C 22 weeks, D 34 weeks. Urinary retention in pregnancy is rare. It is classically described in some women with retroverted uterus which becomes impacted in the pelvis, usually between 8 to 12 weeks of pregnancy and causes outflow obstruction. So it is 10 weeks. Down syndrome is earliest diagnosed at A 8 to 10 weeks, B 10 to 12 weeks, C 12 to 14 weeks, D 14 to 16 weeks. It is 10 to 12 weeks. Earliest diagnosis of genetic defect can be done by Korean villus sampling. Korean villus sampling is carried out transcervically at 10 to 12 weeks and transabdominally 10 weeks to term. When is the folic acid started in pregnancy? 4 weeks prior to conception, 8 weeks prior to conception, 4 weeks after conception, 8 weeks after conception. It is 4 weeks prior to conception. Term placenta weight to baby ratio is 1:3, 1:4, 1:5, 1:6. It is 1:6. The term placenta. Placenta at term is circular disc with a diameter of 15 to 20 centimeters, with thickness of 3 centimeters at center. Persistent occipital posterior position is most common in which pelvis? A android, B gynecoid, C anthropoid, D mixed. It is android. Pregnant uterus will compress ureters at A pelvic brim, uterovesical junction, uterine, uterovesical junction. It is pelvic brim.